Good morning, everyone. I hope everyone is doing well. Today we will be talking about taking care of our health. So nowadays we have people getting sick and getting sometimes the virus, right? So these are some ways that we can get well. Okay, if you feel any, serious problem or you feel that, you're not well at all and you need to see a doctor and it's very, very important, what do? We seek medical attention. Seek means I need, I want it, I'm looking for medical attention, meaning I need to see the doctor right now. Very, very important. Okay, so the first thing we do is we seek medical attention. How do we do that? We can go to the urgent care, we can go to the emergency, right? So this is how we seek medical attention. Okay, let's look at the second picture. See the person, he's not well, right? So he is lying in bed. What is he doing? He is get bed rest. Okay, this is what we should do if we need to get well. We need to get bed rest, which means I need to stay in bed for longer time so I can feel better. Okay, what else do I need to do? See, okay, let's say I have the virus or I'm sick or right? Like I have any other issues, what I should do is I should drink fluids. Drink fluids. You know fluids. Fluids are things that I can drink, like water, soup, tea, juice. All of these things are fluids. And D, as you can see, this man, we need to take medicine. If we have any problem and the doctor gave us medicine, we should take medicine. Okay? So this is how we get well if we are sick. But what if I feel better and now I'm well? Do I need to do anything? Yes. Here it tells us how to stay well. Ways to stay well. Okay? This was get well, meaning I'm sick. I need to get well. And here, I'm not sick anymore, but I need to stay well. I need to be well so that I don't get sick again, right? So let's look at these pictures. What do you see in this picture? I see a lady, she's riding her bicycle. I see a man, he is doing yoga. This lady, she is working out. So I need to stay fit. Stay fit. Stay fit means I need to do exercise so I can be healthy. Okay, we call it stay fit. I need to stay fit or I need to get fit. Okay, fit. F, we see in this picture two people, they are having dinner and they're having salad. That tells us, what does that tell us? That we need to eat a healthy diet. Eat a healthy diet. Now, diet is what we eat, the food that we eat. We should eat healthy food. Okay, this is how we can stay well. G, don't smoke. Don't smoke because smoking is bad for our lungs, right? And especially in the case of the virus that is going around, right? We don't want to make our lungs more weak, more sick, right? So if you can, don't smoke. And this is how we can stay well. What else? What else should we do to stay well? H, have regular checkups. Have regular checkups. This means we should go to the doctor once or twice every maybe like 6 months So we can just check and see if our health is good. Okay, so we see here the doctor, she's saying, Miss Jones, you must stop smoking, right? So we should have regular checkups. Here we have I in this picture. You can see this lady, she's getting a shot. So here it says get immunized, get immunized. Immunized means get a shot, maybe flu shot, maybe any other shot that we need to stay healthy. And the last one, follow medical advice. What does that mean? Follow medical advice. So this lady, what do you see she's doing? She's throwing her cigarettes in the garbage. Why? Because she's thinking about what her doctor said, right? Her doctor, what did she say? You must stop smoking. So what is she doing? She is following. We should also follow medical advice. What the doctor tells us, we should do it. Okay. So here are some other words here we can look at. Injection is the same as shot. It is medicine in a syringe that is put into the body. Okay, it's like a shot injection. Immunization or vaccination is an injection that stops serious diseases. Okay, so immunization means if there is something, for example, we have the coronavirus, if they find a vaccination or vaccine for this disease, then we should get immunized, right? We should get that injection that stops that serious disease, okay? So I want to ask you, number one, how do you stay fit? Do you see here, stay fit? What do you do to stay fit? So right now we are mostly at home. What are you doing right now at home to stay fit? Okay, it could be maybe go for a walk or go for a run, go jogging, maybe do some exercise at home, whatever. How do you stay fit? Number two, what do you do when you are sick? Right? What do you do when you are sick? How do you take care of your health? How do you get well? Okay, so please tell me about that. And number three, which two foods are a part of your healthy diet? What can you give me two foods that you eat that are a part of your healthy diet? What do you eat that is healthy? Okay, so you can answer these questions. Try to give me a voice recording, okay, for these questions. Okay, next, let's continue. There are some more health problems, right? Sometimes we don't feel sick in our body, okay? But sometimes we feel sick in other places, So let's look at these pictures and talk about the different problems that we may have. Look at this picture. What do you see? Right? I see a lady. She's trying to read a book, but it seems like she can't see. So this problem, okay, is a vision problem. Vision. Vision means to do with my eyes, okay? If I cannot see very well, I have vision problems, okay? Two, this lady is trying to talk to this man and he can't hear. So this is called hearing loss. Hearing loss. Maybe I can't hear very well, so I have hearing loss. Three, this lady feels pain. Okay, sometimes we feel pain in our body, but we're not exactly sick. We just feel pain, maybe in our shoulders, in our back, in our head, that type of thing. Four, what do you see in this picture? This lady, what does she have in her head? She has, oh no, I need to be on time or I'm running out of time. She has money in her mind. Maybe she is not. Maybe she lost her job, right? She's worried about her money. We have a crying boy here, right? Maybe his children are giving her a lot of stress. So this is all stress. So right now we have, we are at home, right? And maybe we are feeling a lot of stress because we have children at home. We're worried about maybe our jobs. Maybe we don't have the time, too many things to do, right? So this is another type of problem that we can have. And number 5, we see we have depression. Depression is when I feel so sad all the time. Okay, I feel sad all the time. Now, this problem needs to be taken care of by a therapist. Therapist is a person who helps me when I have depression. Okay, so let's see who will help us with our problems. If I have any of these problems, where do I go? Who do I talk to? Okay, so let's look at number 6. We know this lady, she had vision problems, right? Her eyes, she couldn't see very well. So where does she go? She goes to an optometrist. Optometrist. Okay, let's try that one more time. Optometrist. 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 Okay, or you can say optometrist. Optometrist. Okay, so she goes and visits the optometrist and gets her eyes checked, and the optometrist, she gives her contact lenses. Contact lenses. These are contacts. Contacts means they are like glasses. So you can see number 7, she can give her glasses, but also contact lenses. These are what you put inside your eyes when you don't want to wear glasses. Okay. What about this person here? He had problems with hearing, so he goes to an audiologist. Okay, try that. Audiologist. This person checks his ears and can maybe give him a hearing aid. Hearing aid. Do you see that? Sometimes with people who need help with hearing, they need to use a hearing aid. Okay. What other problems do we have? Well, this person is a physical therapist, okay? Physical therapist. And what this lady is doing is physical therapy, okay? You might have heard physiotherapy, physio, right? Same thing, physical therapy. If you've been in an accident or you have had a health problem, sometimes you will need physical therapy or physiotherapy, okay? This is a person, a physiotherapist is a person who will help you. Okay, 13, 14, we have, remember the lady, she had a lot of stress. So what does she do? She can go to a therapist. Remember this guy, remember therapist? So if a person has depression or stress, they can talk to a therapist, and this is called talk therapy. You're talking and it helps you get better. And number 15, support group. This is a group of people who are going through the same problem like you. So if you are in a support group, everyone helps each other feel better. Okay, so these are the different ways that we can get help with any problems that we have. Okay, so now we're going to go to an activity. We are going to work on some questions about this worksheet, okay? Number 1, look in your dictionary. This is your dictionary, okay? What are the people doing? So we're going to check the picture. Let's look at A. This book is good. This book is good. So let me go here. Anyone reading a book here? So the person, here we have some books. This person might be reading some books. So in the picture, this person is doing what? He is getting bed rest. Getting bed rest. Okay, he's getting bed rest. So I want you to read these sentences and check the correct picture and write what are the people doing. For example, here we have, I have to take 1 capsule 2 times a day. What do you think this is? This picture, right? So this man, what is he doing? He is, don't write the same thing. We're going to write with ing, okay? Because the question is, what are the people doing? He is taking medicine. He is taking medicine, okay? So I want you to finish all 6 questions. You can use any of these pictures to help you. Okay, let's move along. Now, I want you to look at this picture. What do you see this man doing? Do you think he's acting very healthy? He's being healthy? Or is he going more towards being sick? Okay. Read the doctor's note. This is the doctor's note. And then look at the picture. Is the patient following medical advice? What is he doing? What is he not doing? Okay, so let's look at what the doctor says. The doctor says, A, get bed rest. Do you think he's getting bed rest? He looks very tired. B, drink fluids. Drink fluids. C, take medicine. D, eat a healthy diet. Look here. Do you think he's eating a healthy diet? And E, don't smoke. So what I need you to do is I want you to write me 4 sentences here telling me, what is this man doing? Is he getting bed rest or no? So for example, the doctor said, get bed rest. Sentence, he isn't getting bed rest. Why? Because you can see his eyes, they are so tired. So the man, he is not getting bed rest. So you can tell me he is maybe one of these things, right? Or he isn't. Okay, so you would give me 5 sentences about this picture. Okay. All right, in the next one, we are also going to look in our dictionary to tell me what is the problem. Okay, what is the problem? So A, I can't read this. Why are the words so small? If you go to the picture, who can't read a book? This lady, she can't read a book. She thinks the words are too small. So she has, what's her problem? Vision problems, okay? So I want you to read the sentences, look at the picture, and tell me what is the problem. Next, we have 2 pictures here. Actually, these are pamphlets. This is a paper that gives us more information, okay? And in order to help us with any problem we have. So in this pamphlet, what we need to do, circle the words to complete the pamphlets. You will have 2 words, okay? For example, A, we have vision problems, hearing loss. So you see the picture, a lady's wearing glasses, you see an eye chart here. So do you have vision problems or hearing loss? Which one? I can see from the picture, this is about vision problems. So I circle vision problems, all right? So same thing here. You're going to have be, 2 words. You have to choose whichever word is the right word. So B, C, D, you're going to circle the correct word. Same thing with number 2. Are you feeling tired and sad most of the time? So if you feel you are any of this tired or sad, you can read this pamphlet. But again, I need you to circle the correct word, okay? And the last thing, number 5, what about you? What do you do when you feel stress? Okay, so I need you to give me maybe 5 sentences, okay? 5 sentences about what do you do when you feel stress. You can write this, but I really need you to speak it, okay? So if you can give me a voice recording about what do you do when you feel stress. For example, when I feel stress, I exercise, okay? And if you want, you can also do this. How do you take care of your health? What do you do? What don't you do? So I want you to give me some examples that you are taking care of your health right now. So with coronavirus and everyone being sick and everyone being in their house, there's a lot of problems happening with health and stress. So I want you to tell me, what are you doing now to help you with stress, and how are you taking care of your health? Okay. All right, everybody. I hope you have a good day. Bye-bye.